Hello, my name is Charles James. I'm the Executive Director of the Rural Advantage ACO. Today is March 29th, 2024. I'm here to tell you a little bit about us. Our mission, quite simply, is provider and patient well-being. We consciously put provider before patient for our organization on the premise that our providers need a lot of support and they cannot treat patients well if they themselves are not well. So our mission at Rural Advantage is provider and patient well-being. Many of you know me as the President and CEO of North American Healthcare Management Services, through which and at the head of which we've provided RCM, billing services, EHR hosting, implementation, and importantly, rural health clinic and FQHC, implementation, oversight, cost reporting, billing. We specialize in rural health clinics. From that vantage point, we created Rural Advantage Accountable Care Organization to apply our expertise in rural health to try to get our rural health clinic clients more reimbursement. It's that simple. Our medical director is Dr. Kelsey Hopkins, who hails from Greenville, Illinois. Rural Advantage, we're headquartered in St. Louis, so Dr. Hopkins is right up the road from us. Dr. Hopkins is a fantastic physician. He and his partner, Dr. Siefkin, have put together an excellent primary care office in Greenville, Illinois. And Dr. Hopkins came on as our medical director to apply or help Rural Advantage apply what we know clinically and help our participants, providers, thrive in a value-based care environment. Pinnacle Healthcare Consulting, Kelly Conroy, and as importantly, her colleague Daniela Yusufbekova are our technical assistants, our knowledge base in the ACO world, and they've been helping us for several years now create our value-based care offering for rural health clinics. As we mentioned, our main drive and our main focus is to help our providers increase revenue for what they're already doing and not necessarily having to just see more patients. We are a shared savings upside only Medicare shared savings track A right now, and you can see on this chart it's the lowest risk option in value-based care arrangements that there is. So we're here to help those who may already have some experience in value-based care, aren't quite ready for risk, but we're also bringing rural health clinics and other participants in that don't have any experience in value-based care. So we're offering a risk-free, no downside opportunity to participate in Medicare shared savings. I like to think of it as kind of like a 401k for your Medicare dollars. Medicare matches isn't quite the right word, pays an incentive. It is upside only, and we're never going to come for a check in upside only. There's no downside risk to this model. We help you see who Medicare has attributed to you. We provide your patient attribution and assignment data. You're seeing patients that may be attributed to others, and patients that you think are your Medicare patients are actually attributed to someone else. So we help illuminate that data and push that data to you in useful ways. We offer benchmark historical trending so that we can see where you've been and where we need to go. Of course, the ACO determines what the quality metrics we're going to follow are, and as importantly, we're going to help assess documentation so that when we come to access documentation is actually the documentation that your providers have taken that demonstrates savings. We go to check that the documentation matches what we've reported was done, perhaps via claims. Documentation is where our ACO is going to thrive. We're track A. This data is a little out of date, but lowest risk, no downside risk. You can see other tracks as you move up the risk threshold, but Rural Advantage is not participating in risk yet, but we plan to in the future. Provider payments are over and above claims revenue. There's no effect on claims. Shared savings comes in addition, outside of, parallel to. There's no negative or positive impact on claims in the immediate term. Our scorecard is, have we retained or grown our patient attribution? How many annual wellness visits have we done for eligible patients? We provide education and learning. We hope to help with provider engagement. That's often one of our biggest barriers. And we provide utilization data to your organization. How many ER visits do you have? How many days of, what's your length of SNF days? How many readmissions do you have? How many ER visits, if I didn't already say that? So utilization data is also where we demonstrate savings by reducing ER admissions, by reaching out to our patients that are frequently in the hospital and reducing those hospitalizations and treating the patients before they get hospitalized. We're here to reduce cost to the system. That is what savings is. So we're here to reduce the cost of our attributed patients to the Medicare system by keeping them out of the hospital, lowering SNF days, keeping them out of the ER, and not having them readmitted if they do go back into the hospital. Here's some of what our practice stats look like. We're going to provide you, here's how many eligible patients you had for annual wellness visits. Here's how many were completed. It's a sample of our scorecard. It's very straightforward. We focus on attendance at our educational sessions and quarterly meetings in person, or all of them are virtual, panel size retention, annual wellness visits, transitional care management, and utilization. Those are our scorecards. We never affect your provider-patient relationship. We never come in and tell you how to practice, or this patient should have had X or Y, or this patient you didn't do A or B. We're not here for that. We do not affect. We're here to offer you tools, and we do not ever seek to affect your provider-patient relationship. We take 75% of savings and return to providers. 25% of Medicare shared savings comes to the ACO. So our split is 75-25, 75 return to the providers. We are rural health clinics. This is all at the EIN level. So all providers under a particular EIN will participate. 75-25. We help straighten out annual wellness visit and CPT-2 reporting in the context of rural health and help apply these to your other Medicare Advantage payers. So critical. We're helping with your claim stream. We look at claims and help make sure that our wellness visits and preventive services and CPT-2 codes are being utilized correctly. We provide a lot of technical assistance on this topic. There's no cost to get in. There's no downside risk, and we don't have a long-term contract. Our contract is year to year. Many others sign you up for 5 years. We're assuming total risk. So if you come in, we never achieve savings with you, but we provide a lot of activity for you, you're not paying anything. This does not reconcile like an RHC cost report. We're not going to come back to you for a check. We're not going to take on risk without you knowing. And what we really are here to do is help make sure your RUC claims or your FQHC claims appropriately reflect preventive services. We don't affect participation with Medicare Advantage or other value-based products, but we can help assist you to achieve incentives with your Medicare Advantage population. I'd love to take any questions or comments. Here's my contact information. We'll be at Torch. Hope to see you then. Thank you very much. Please come by and see us.